What to know about cancer. What is cancer? Causes, treatments, types, outlook, takeaway. Malignancy makes cells partition wildly. This can bring about tumors, harm to the resistant framework, and other debilitation that can be lethal. In the United States, an expected 15.5 million individuals with a background marked by disease were living as of January 1, 2016, as per a 2018 report from the American Cancer Society. In this article, we look at sorts of malignancy, how the infection creates, and the numerous medicines that assist with working on the personal satisfaction and endurance rates. What is disease? Photograph altered by Stephen Kelly. Science Photo Library. Steve Gschmeissner, CSA Images, Getty Images. Disease is a wide term. It portrays the sickness that outcomes when cell changes cause the uncontrolled development and division of cells. A few sorts of disease cause fast cell development, while others cause cells to develop and isolate at a more slow rate. Certain types of malignancy bring about noticeable developments called tumors, while others, like leukemia, don't. The majority of the body's cells have explicit capacities and fixed life expectancies. While it might seem like something awful, cell passing is important for a characteristic and gainful marvel called apoptosis. A cell gets guidelines to kick the bucket so the body can supplant it with a more current cell that capacities better. Destructive cells do not have the segments that teach them to quit separating and to pass on. Thus, they develop in the body, utilizing oxygen and supplements that would typically sustain different cells. Carcinogenic cells can shape tumors, impede the invulnerable framework and cause different changes that keep the body from working consistently. Harmful cells may show up in one region, then, at that point spread through the lymph hubs. These are groups of insusceptible cells situated all through the body. Causes. There are numerous reasons for malignancy, and some are preventable. For instance, more than 480,000 individuals bite the dust in the U.S. every year from smoking cigarettes, as indicated by information detailed in 2014. As well as smoking, hazard factors for malignant growth include substantial liquor utilization, overabundance body weight, actual inertia, helpless sustenance. Different reasons for malignant growth are not preventable. As of now, the main inevitable danger factor is age. As indicated by the American Cancer Society, specialists in the U.S. analyze 87% of disease cases in individuals ages 50 years or more seasoned. Is malignant growth hereditary? Hereditary components can add to the advancement of malignant growth. An individual's hereditary code advises their cells when to isolate and terminate. Changes in the qualities can prompt broken guidelines, and malignancy can result. Qualities likewise impact the cell's creation of proteins, and proteins convey large numbers of the guidelines for cell development and division. A few qualities change proteins that would normally fix harmed cells. This can prompt disease. On the off chance that a parent has these qualities, they may give the modified directions to their posterity. Some hereditary changes happen after birth, and factors, for example, smoking and sun openness, can expand the danger. Different changes that can bring about malignant growth happen in the compound signals that decide how the body conveys, or communicates, explicit qualities. At long last, an individual can acquire an inclination for a sort of malignancy. A specialist may allude to this as having an inherited disease disorder. Acquired hereditary changes fundamentally add to the advancement of 5 to 10% of disease cases. Medicines. Imaginative examination has powered the advancement of new prescriptions and treatment innovations. Specialists ordinarily endorse therapies dependent on the sort of malignancy, its stage at conclusion, and the individual's general well-being. The symptoms of chemotherapy incorporate going bald. Be that as it may, progresses in therapy are working on the viewpoint for individuals with malignancy. The following are instances of ways to deal with malignancy treatment. Chemotherapy means to kill malignant cells with prescriptions that target quickly partitioning cells. The medications can likewise assist with contracting tumors, however the results can be extreme. Chemical treatment includes taking drugs that change how certain chemicals function or meddle with the body's capacity to create them. At the point when chemicals assume a huge part, likewise with prostate and bosom tumors, this is a typical methodology. Immunotherapy utilizes meds and different therapies to help the resistant framework and urge it to battle harmful cells. Two instances of these medicines are designated spot inhibitors and receptive cell MU. Accuracy medication, or customized medication, is a fresher, creating approach. It includes utilizing hereditary testing to decide the best therapies for an individual's specific show of disease. Specialists still can't seem to show that it can adequately treat a wide range of malignancy, notwithstanding. Radiation treatment utilizes high-portion radiation to kill dangerous cells. Likewise, a specialist may prescribe utilizing radiation to recoil a tumor before medical procedure or diminish tumor-related side effects. Indifferentiated organism relocate can be particularly gainful for individuals with blood-related tumors, like leukemia or lymphoma. It includes eliminating cells, like red or white platelets, that chemotherapy or radiation has annihilated. Lab specialists then, at that point, reinforce the cells and set them back into the body. Medical procedure is frequently a piece of a therapy plan when an individual has a carcinogenic tumor. Likewise, a specialist may eliminate lymph hubs to lessen or forestall the infection spread. Designated treatments perform capacities inside dangerous cells to keep them from duplicating. They can likewise help the insusceptible framework. Two instances of these treatments are little atom medications and monoclonal antibodies. Specialists will frequently utilize more than one sort of treatment to expand adequacy. Types. The most widely recognized kind of malignant growth in the U.S. is bosom malignant growth, trailed by lung and prostate diseases, as per the National Cancer Institute, which avoided non-melanoma skin tumors from these discoveries. Smoking builds the danger of various sorts of malignant growth. Every year, in excess of 40,000 individuals in the nation get an analysis of one of the accompanying sorts of disease: bladder, colon and rectal, endometrial, kidney, leukemia, liver, melanoma, non-Hodgkin's lymphoma, pancreatic, thyroid. Different structures are more uncommon. As per the National Cancer Institute, there are more than 100 sorts of malignancy. Malignancy advancement and cell division. Specialists arrange malignancy by its area in the body, the tissues that it frames in. For instance, sarcomas create in bones or delicate tissues, while carcinomas structure in cells that cover inward or outside surfaces in the body. Basal cell carcinomas create in the skin, while adenocarcinomas can frame in the bosom. At the point when malignant cells spread to different pieces of the body, the clinical term for this is metastasis. An individual can likewise have more than each sort of disease in turn. Viewpoint. Enhancements in malignancy recognition, expanded familiarity with the dangers of smoking, and a drop in tobacco use have all added to a year-on-year decline in the quantity of disease determinations and passings. As indicated by the American Cancer Society, the general malignant growth passing rate declined by 26% somewhere in the range of 1991 and 2015. At the point when an individual has malignancy, the standpoint will rely upon whether the sickness has spread and on its sort, seriousness, and area. Takeaway. Malignant growth makes cells partition wildly. It additionally keeps them from biting the dust at the normal point in their life cycle. Hereditary elements and way-of-life decisions, like smoking, can add to the advancement of the infection. A few components influence the manners in which that DNA speaks with cells and coordinates their division and demise. After non-melanoma skin malignancy, bosom disease is the most well-known sort in the U.S. in any case. Cellular breakdown in the lungs is the main source of malignant growth-related demise. Medicines are continually improving. Instances of current strategies incorporate chemotherapy, radiation treatment, and medical procedure. A few group profit with more up-to-date choices, for example, foundational microorganism transplantation and accuracy medication. The finding and demise paces of disease are dropping yearly.